Welcome to Neuroanatomy. In this video, we'll explore the protective coverings of the brain and spinal cord, the meninges, and understand how cerebrospinal fluid circulates and protects the central nervous system. The brain and spinal cord are enclosed by three protective membranes collectively called the meninges. Between these layers, the cerebrospinal fluid circulates. A simple mnemonic to remember their order, from outer to inner, is DAP, dura, arachnoid, and pia. The outermost layer is the dura mater, a tough fibrous sheet. Beneath it lies the arachnoid mater, a web-like membrane, and the innermost layer, the pia mater, is a thin vascular layer tightly bound to the surface of the brain and spinal cord. The cranial dura mater has two layers, an outer periosteal layer and an inner meningeal layer. Between them lie the venous sinuses. The meningeal layer extends inward as dural folds, the falx cerebri, tentorium cerebelli, and the smaller falx cerebelli. The arachnoid mater is a thin, transparent membrane. Beneath it lies the subarachnoid space, which contains cerebrospinal fluid and blood vessels. The arachnoid bridges over the brain sulci, forming cisterns at wider spaces. The pia mater is a delicate, highly vascular membrane that closely follows every contour of the brain and spinal cord. It forms part of the choroid plexus, which is responsible for producing cerebrospinal fluid. Cerebrospinal fluid is a clear, colorless fluid that fills the ventricles and subarachnoid space. About 150 milliliters are present at any time, produced mainly by the choroid plexus. Its functions are easy to recall using the mnemonic CBS: cushioning, buoyancy, and support. The CSF is formed in the choroid plexuses of the lateral, third, and fourth ventricles. From the lateral ventricles, it passes through the foramen of Monro into the third ventricle, then through the cerebral aqueduct into the fourth ventricle. It exits through the foramina of Luschka and Magendie to reach the subarachnoid space and is finally absorbed into the venous sinuses via arachnoid villi. A fun mnemonic to trace the path is L3A4FMASV, L3 Aqua 4 foramina make a smooth voyage. CSF is absorbed through arachnoid villi or granulations into the superior sagittal sinus. Under normal conditions, the rate of absorption equals the rate of formation, maintaining constant intracranial pressure. Clinically, meningitis refers to inflammation or infection of the meninges. Hydrocephalus occurs when CSF accumulation increases due to obstruction. Raised intracranial pressure may result from increased CSF production or decreased absorption. These standard textbook diagrams from Grays, Snells, and Guyton beautifully illustrate the meninges and CSF circulation pathway. You can use them as references for drawing or animation. To summarize, the meninges, dura, arachnoid, and pia protect the CNS. CSF cushions and supports the brain, circulating through the ventricles and subarachnoid space before being absorbed into venous sinuses. Remember DAP for meninges, CBS for functions, and L3A4FMASV for the CSF flow. Hey docs, that's all for the day. Thanks for watching the video. I hope you enjoyed it. If you enjoyed it, please hit the like button, comment down, and subscribe for more such videos.